In this video, I will deliver a talk on neuromuscular transmission. All of you might have heard this term, neuromuscular transmission. Actually, we will be talking about the talk between neuron and the muscle. Neuromuscular transmission we can see with the neuromuscular junction. Let us see this is the spinal cord, cross section of the spinal cord, cross section of the spinal cord, and here we have anterior horn. This is anterior horn or ventral horn. Ventral horn. We have the dorsal horn, and here we have lateral horn. Now if we look at the motor neuron, actually motor neuron comes out from this. Motor neuron comes out from anterior horn of spinal cord. This is the cell body, and then we have the nerve ending. This is the nerve ending, or we can say this is the presynaptic terminal. This is the membrane of presynaptic terminal. Synaptic terminal or presynaptic membrane, and then it is terminated in the muscle. We have the muscle fibers. Here we have, this is the muscle fibers. Here we have myofibrils. This is the actin. This is the actin. And this is the actin. The actin. And in between actin, we have thick filament, that is myosin. We have myosin filament. This is the T tubule, and then we have sarcoplasmic reticulum. In this side also we have sarcoplasmic reticulum. This is sarcoplasmic reticulum. This is T tubule or transverse tubule, or it is called T tubule. And then this is the cistern, where we can see the full of calcium ion. Actually, whole sarcoplasmic reticulum is filled with calcium ion. But again, if you look at the concentration difference, here we will get more concentrated calcium ions in the cistern. Now the gap between, this is the post-synaptic membrane, post-synaptic membrane, and the gap between this nerve ending and the muscle fibers, this gap is called synaptic cleft. Is a gap. Now coming to the neuromuscular transmission, where we will be talking about the action potential which is generated here, which will reach here in this action potential, and then this action potential will help in releasing neurotransmitter. So first there will be an availability of action potential, and this action potential will help on releasing neurotransmitter from the nerve ending, and then this neurotransmitter will act on specific receptors, and again there is a generation of action potential. So here electrical events, this action potential will be transferred to a chemical event, and then chemical event again will be transferred to electrical one. So these three mechanisms we are supposed to explain, and together this is called neuromuscular transmission. So here the nerve ending will keep on talking. This nerve ending will keep on talking, and the muscle fiber will keep on listening. So there is a relationship between nerve ending and the muscle fiber. This nerve ending will keep on talking, and the muscle fiber will keep on listening. This transmission is one-sided. This transmission, this will not be going back, means opposite direction transmission. Opposite direction means the electrical event from muscle to nerve never takes place. So opposite direction will not be there. So this is unidirectional, and in this unidirectional, the behavior between this and this, or the relationship, this will keep on talking and this will keep on listening. Now coming to the mechanism, first we will be talking about the composition of nerve ending. Here we have vesicles. And the vesicles are filled with neurotransmitter, and special it is acetylcholine. Now question comes, this vesicle, what is the source of this vesicle? The source of this vesicle, actually this vesicle, empty bag, or we call it empty bag, it comes from the cell body, and then it is filled with the neurotransmitter here in the nerve ending, and this neurotransmitter ultimately is utilized for transmission process. Now first, what will happen if there is an action potential? So what will happen? There is a voltage gated sodium channel, and this sodium channel will bring the cations in. So there will be a lot of positive charges here, and this sodium channel, once it is positively charged, then it will help to stimulate the calcium channel. So there will be an entry of calcium ion. So what is the function of this calcium ion? This calcium ion actually will help in bringing the vesicle towards the membrane. Before that, there is a synthesis of acetylcholine inside the vesicle. Now my duty is to tell you how the acetylcholine is being formed. Now here acetylcholine has two parts. One is acetate and another is choline. This choline is actually available. This is the stomach, intestine. This choline is available in the food, and after digestion this choline is absorbed, and then through blood ultimately it will be available here, and this choline, with the help of special transporter, it will enter into the nerve ending. And then we have the mitochondria here, and this mitochondria will provide acetyl-CoA. This acetyl-CoA plus choline, there will be a formation of acetylcholine and CoA will be released. Again I will repeat how the acetylcholine is being formed. Acetyl-CoA, the source of acetyl-CoA is the mitochondria, and the choline comes from the food, and with the help of special transporter, the choline will enter into the nerve ending. This choline will be united with the acetyl-CoA, that is the enzyme is acetyl-CoA transferase, or the enzyme for this is acetylcholine transferase. This is enzyme which is responsible to form acetylcholine is acetylcholine transferase. So ultimately there will be a formation of acetylcholine. Acetylcholine is being formed, but how it will enter into the vesicle? So for that there is a channel. Here this will be acetylcholine will be actively transported here. Why actively transported here? Because here the acetylcholine concentration is less as compared to the concentration present in the vesicles. So this acetylcholine will be actively transported, and then another transport mechanism also we must remember here. Here there will be hydrogen ion is essential here. So hydrogen ion will be sent to the vesicles with the help of ATP. ATP will be utilized here. There will be formation of ADP and the phosphate. So what I want to say is, due to the special transport mechanism, here the acetylcholine will be stored in the vesicles. Now if we draw the diagram properly, we must remove all these things. So here it is the nerve ending, and here we have vesicles, and these vesicles is stored with acetylcholine. And this is because of a transport mechanism where hydrogen ion is sent to the medium and the acetylcholine is brought to the inside of the vesicle, and here there is another transport mechanism. In this, the hydrogen ion is sent with the help of ATP. This is the primary transport. There is a need of ATP energy. So ATP is utilized here. Hydrogen ion is sent into the vesicles. So this hydrogen ion is going towards this, and the acetylcholine enters into the vesicle. So this transport mechanism, this is the secondary active transport, this is secondary active transport, and this is primary active transport, and ultimate aim is the acetylcholine is stored in the vesicles. Now what will happen? Here if we draw, this is the sodium channel, this is the voltage gated sodium channel, and we will have the depolarization wave. So depolarization wave, this is depolarization wave, depolarization wave, and this depolarization wave will help again stimulate the voltage gated sodium channel, and then it will help to stimulate the calcium channel. It will help to stimulate calcium channel. Now what will happen? The vesicles will have two type of protein. We'll have two type of protein. These vesicles will have two type of protein. That is here this vesicle will have two type of protein. One is synaptotagmin, and another is synaptobravin. And from this side also, in the membrane side also we will have two proteins. If we name, it is SNAP25, and the another protein is syntaxin. So what will happen? These are membrane docking protein. Whenever there is a stimulation, action potential is moved. That is, I have named that it is one type of depolarization wave, and this depolarization wave will stimulate sodium channel, and again this wave will help or will stimulate the voltage gated calcium channel. So the calcium ion enter into the cell. This calcium ion will help on bringing the vesicle towards membrane. How it will come here? Now we have the two proteins here which is attached to this membrane present in the vesicle, and another two protein, it is attached to the presynaptic membrane. So what will happen? There will be an attraction. There will be say this is two protein and this is two protein. So there will be a pulling. So this one will pull and this one will pull. So there will be a pulling between these four protein. So what will happen? If pulling is there, if this type of pulling is there, then this vesicle will move towards this. So if we want to draw the diagram, so this is the vesicles. Because of this pulling, this vesicle will move towards the presynaptic membrane, and this vesicle is filled with the acetylcholine. Now there is a fusion will be there, and after some time this fusion will help in releasing acetylcholine, into the synaptic cleft. Now, due to the concentration gradient, here concentration is more, here concentration is less, so easily the acetylcholine will enter into the synaptic cleft with the help of exocytosis. This is the exocytosis here. With the help of exocytosis, the acetylcholine will release into the synaptic cleft. Now again there will be a diffusion because concentration is more here and concentration is less here. So it will move towards sarcolemma. This is the membrane of the muscle fiber membrane. Now it will bind, listen carefully, it will bind with a receptor, and this receptor, actually if we draw the diagram of this receptor, see this is the nicotinic receptors, and these receptors, it looks like this. It has got 5 proteins, 1, 2, 3, 4, 5. 5 proteins are there, and generally during normal condition, when there is no stimulus, then this pentanic protein is arranged such a way there will be no exchange, there will be no movement of any type of ions during resting condition when there is no stimulus. This is the pentanic protein alpha 2, beta, gamma and delta. This protein is called alpha 2, beta, gamma and delta. This is 2, 3, 4, 5. So this pentameric protein, actually this is called nicotinic receptors. Nicotinic receptors. As soon as acetylcholine will bind, there will be a conformational change. There will be a conformational change, and this conformational change will bring the movement of ions. Now question comes, which movement will come in? Which ion will come in? We have, as you all know, we have sodium ion. The outside concentration of sodium is more than the inside, so sodium ion can in, or there will be an exit of potassium ion. What I have said, there is a possibility to bring sodium ion inside because outside sodium ion concentration is more than the inside concentration. So there is a possibility to bring sodium ion in, or there is a possibility to release potassium ion. There is an exit of potassium ion that can also be there. But in this case, the resting membrane potential here is minus 90 millivolt, or not minus 80 millivolt, minus 90, say it is minus 80 millivolt. So this minus 80 millivolt is this potential is close to the equilibrium potential of potassium ion. What I am saying, this negative potential is close to the equilibrium potential of potassium ion. What is the equilibrium potential of potassium ion? That is minus 85 millivolt. Because of this, there will be no exit of potassium ion. Because of this, there will be no exit of potassium ion. फिर रहेगा कौन? Sodium ion. So there will be an entry of sodium ion. So there will be no exit of potassium ion. Only there will be an entry of sodium ion as soon as this acetylcholine bind with this receptor. Then what will happen? We have this receptor, nicotinic receptor. This nicotinic receptor actually ligand gated channel, ligand gated. This is ligand gated. This is not voltage gated. So if there are many such type of receptors are there, so there will be an entry of sodium ion. So what will happen? This minus 80 millivolt will be changed to minus 60 millivolt. Now as soon as this become minus 60 millivolt, there will be a stimulation of voltage gated sodium channel. So the sodium ion will come in, voltage gated sodium channel. So what will happen? There will be generation of action potential here. So there will be a generation of action potential here, and this action potential will move towards every side of the muscle fibers. Now here we have receptors here in the T tubule. Which receptors I am talking about? Again, if we draw the diagram something different way, if you draw the diagram, so here we have DHP receptors. If I want to make this diagram again, I think I must remove this. So here it is the T tubule. It is the T tubule, and then we have sarcoplasmic reticulum. Here also we have sarcoplasmic reticulum, which filled with the calcium ions. Now here we have receptors, that is DHP receptors. See, this is the diagram of DHP receptors. This is DHP receptors or dihydropyridine receptors. Dihydropyridine receptors. So these DHP receptors will be stimulated as soon as action potential is moved towards the T tubule. These DHP receptors will be stimulated. Now what is the function of these DHP receptors? There is a receptors present here. In the membrane of sarcoplasmic reticulum. So this is the membrane of the sarcoplasmic reticulum. So what is the role of DHP receptor? This receptor will hold this. This receptor is called ryanodine receptors. Ryanodine receptors. So what will happen? As soon as this DHP receptors is stimulated, this receptor will pull the ryanodine receptor such a way so that there will be a gap. Will be there, and the calcium ion will come out. This calcium ion will come out from the cell because concentration is more here. Because of this pulling, the calcium ion will be released, and this calcium ion will bind with troponin C, and there will be a contraction. Now again relaxation will be there. So there is another channel is there, voltage gated potassium channel. So there will be an exit of potassium ion. So there will be a relaxation or repolarization. So what I have explained here, I have explained again. If we repeat, then what I want to say is the vesicles is there. This vesicles is filled with the acetylcholine, and this acetylcholine will be released, will be moved because of the movement of calcium ion, and then fusion will be there. So the acetylcholine will be released, and this fast entry of sodium ion will bring the potential from minus 60 millivolt to plus 30 millivolt, and then once it is plus 30 millivolt means this is the action for depolarization wave. This depolarization wave will stimulate DHP receptor. These DHP receptors will pull the ryanodine receptor, so the calcium ion will be released during contraction. And then relaxation, again there is a voltage gated potassium channel. There will be an exit of potassium ion, so the potential again will be altered. Plus 30 millivolt will be changed to minus 80 millivolt or minus 90 millivolt. So this is the way we can think about the mechanism behind mechanism of neuromuscular transmission. Now here the one thing I must inform here, I must tell you that this acetylcholine which is released here, few of acetylcholine will be joining or will stimulate the specific receptor, cholinergic receptors, but some amount acetylcholine will be destroyed. So there will be a formation of choline and then acetyl-CoA. The choline again will be taken up, and this acetyl-CoA will enter into the blood, and then it will go to the liver for metabolic purposes. So this is the short story of neuromuscular transmission, how the electrical impulse is converted to chemical transmission, and then chemical transmission is converted to the electrical events, action potential. Thank you.